Hi everyone, it's Sandy Kiaizadeh here at Mindful Solutions Clinic at 320 Danforth at the Carrot Common, and welcome to my second vlog. This is the second one that I'm doing, and I'm still getting used to this, to be honest. I'm not too sure how comfortable I am doing this camera work, but here we are today. And so I thought for today what we do is we talk about, for those among you who are thinking about starting counseling, and but you haven't yet found a therapist, and you're sort of wondering what therapy looks like, or you've got some apprehensions about the process, or maybe you're looking for a therapist and you just kind of don't know what to look for in a therapist. That's what today's vlog is about. It's really, how do you spot a good therapist? What are the good sort of signs of good therapy? So the very first thing to sort of start wrapping your head around is that, therapy is, it's not friendship, although it is a very it can be a friendly, depending on the person, the therapist that you're working with, it can be a very friendly, warm environment, and certainly it should be a warm environment where you feel comfortable talking and working through some of the concerns that you have. But it is a purposeful relationship, and it's a purposeful relationship that is all about you. So where a friendship is more about it's mutual. You get to know the other person, and the other person gets to know about you. In a therapeutic environment, it really just sort of all boils down to it's all about you. And how wonderful is that, right? To have a space where you can just focus on you and focus on your concerns and what you want to talk about and the goals that you want to work through. So that's the very first thing. The second thing, in terms of what distinguishes good therapy versus not so good therapy, is that good therapy is evidence-based. It's grounded in scientific research that actually, that proves that whatever methods the therapist is using, it is evidence-based. So, in terms of, for instance, the way I work, I've been trained in a number of different therapeutic modalities that tend to be, brief modalities. So things like cognitive behavioral therapy and solution-focused brief therapy. I use a lot of mindfulness-based therapies as well. I use clinical hypnotherapy. These are all modalities that are incredibly evidence-based. There's tons of research on each of these modalities that actually prove their efficacy. So that's, the other thing that you should be looking for is when you are sort of going out there and interviewing therapists, is to ask them, what kinds of therapies they use. And, maybe even do your own research. Once you hear what they're, how they tell you they work, do your own research to find out how evidence-based, what modalities they use, how evidence-based those modalities are. The other thing that distinguishes sort of good therapy and not so good therapy is that, a therapeutic space is non-judgmental. And so, I'm sort of hesitating right now. I just got out of a session with a client who, this particular client is not the first one who shared this with me. But there are so many of us out there who have had negative experiences with health professionals. Negative in terms of we didn't feel heard, right? Like we didn't feel validated. This particular client was talking about having seen therapists in the past who, and I can't understand how this would have happened, but this particular client's experience was that, therapists in the past didn't understand, and didn't convey certainly that understanding, didn't validate that understanding, or that, and didn't show the empathy or the compassion for for what the client was going through.
Um, so if that's what you're feeling in that environment, that's kind of a signal that you haven't aligned with the therapist, and certainly you're not feeling heard. If you're not feeling heard, you could have the most brilliant therapist sitting across from you who's highly educated from the best schools, um, trained in a number of different evidence-based modalities. But here's the kicker: if you're not feeling heard, if you're not feeling like that therapist is empathizing with you, if you're feeling judged, if you're not connecting with that therapist, or there's a niggling part inside of you that doesn't really trust that therapist, you pay attention. Pay attention to that sign. Certainly, one thing I always tell my clients, I have free consultations with my clients, with potential clients, as a first step to any before working with a client. And one thing I tell every single person that I speak to on the phone at these free consults is, the purpose of the free consult that I offer is to see whether we are a good sort of fit, personality wise, right? Because again, I know what my training is. I know I am well trained, but ultimately, if you're not feeling comfortable with whatever aspect of my personality, you're not going to feel comfortable to do the work that's needed in therapy, right? You're not going to feel comfortable opening up to me if there's a part inside of you that doesn't like me, and that's okay. Like, that's okay that if you don't like me. And so what I tell my clients is, if ever over the course of our work together, if there's ever something that I'm saying or doing that's just not sitting right with you, tell me. Like, actually tell me, and let's talk about that. And if through the course of our conversation, it comes to be that you decide that you don't want to continue with me, I'm cool with that. I'd rather you actually tell me, and I'd be happy to make some referrals to some colleagues that I know who might be a closer match and a closer fit for you. So that's what I mean about, it's about the importance of having that open and honest dialogue with your therapist to feel comfortable in sharing these kinds of difficult conversations. In addition to the other difficult conversations that you likely will be having anyway, because you're coming to therapy because you've got some concerns that you want to work through. So keep that in mind. If you're not feeling heard, if you're not feeling validated, if you're not feeling sort of empathy from your therapist, pay attention to that. Bring it up with your therapist, whoever that is, whether it's me, whether it's whoever else, and try to work through it. And if you're not seeing resolution there with that therapist, I'd say ask for referrals to somebody else and seek it out. Okay. So that actually sort of went into my next point, which is open, honest communication. Look, I recognize sitting in this chair and opening up to a stranger is really difficult. It's really hard to do that, to open up to a stranger. What I promise to do in all of my sessions is to try to make you as comfortable as possible. And, I let all my clients know that if ever I ask a question, or if you feel I'm veering the conversation off in a direction you're not yet comfortable with, tell me. Tell me, just kind of, do a timeout, Sandy. This question that you've just asked me, I'm not sure I'm yet, I'm ready to talk about this yet. Okay, we'll park that and we'll go where you need to go. But having said that, keep in mind that when you initially start therapy, certainly when you start therapy with me, I'm a very goal oriented therapist. So it's really important for me over the course of our work together to hold your goals in mind. And just sort of know that if I am sort of veering us off into a particular direction that may not seem, that may seem a bit odd to you, just kind of know that there is a little bit of method to my madness, in that,
I'm holding your big goals in mind, and I'm trying to get you there, because my goal isn't to have you be my client for the rest of your life. Again, the modalities that I've been trained in is considered sort of brief therapy. My goal is for you to come into our sessions to, get new perspective on your situation, to learn new strategies on how to live, your best life. And then once you've learned those strategies, my goal is to have you sort of go off into your life and live your life, and not necessarily come see me week after week. I've got some clients that I worked with for a brief period of time. So we're talking 10 to 15 sessions, and then they go off and live their lives, and then they'll come back when they need a check-in or when they need a tune-up, and that's cool. That's the way I practice therapy. So yeah, a good therapist would be somebody who sort of encourages your independence, right? Who encourages you to tap into your own inner wisdom, to tap into your resilience. Like, you are a powerful person, and a good therapy can help reconnect you with what your values are and what really matters to you. And good therapy encourages you to go off and live your life, right? To go off and practice those tools and use them and actually reap the rewards of the practice. And here's the last point, and I saved it for last because it's the most important. And so the last point is, be prepared to do the work. Be prepared to do the work. Therapy is work. It's not easy at times. Some sessions are easier than others. But the kind of therapy that I practice, there's a lot of psychoeducation that's involved, where I teach strategies. I sort of teach you these new tools. The real work doesn't happen in the 50 minutes that you and I spend together, once a week. The real work for you happens when you're out there living your life and practicing this new way of being, or practicing the tools. If you're not yet ready to do the work, if you're not yet ready to talk about, if you've got deep, dark stuff, not all my clients do, but some of them do, but if you're not yet ready to talk about the deep, dark stuff, get yourself to a place where you will feel comfortable, first of all, talking to a therapist about it, but also doing the sort of the continuous work that's involved. One of the things I recommend to all my clients is keep a therapy journal to do a lot of the self-reflecting that's done outside of the session. So yeah, be prepared to do the work. So those are some of the tips that I have. Second blog, over and out. If you've got any questions, feel free to email me and or visit my website at www.mindfulsolutionsclinic.com. All right, thanks guys. Take care. Bye.